Hello jokers! Chewing well means you're going to keep yourself very healthy. And here's the reasons why. Thanks for watching this episode of Joker's Physiotherapy. So, what's got the chewing to do with being healthy? Okay, so being able to chew well means you're going to have a very good set of jaw joints, right and left, working well, because when you chew, with each meal, you probably chew up to about 2,000 times. 3 meals, it'll be 6,000 chews per day if you are if you eat properly and spend enough time chewing and enjoying your food. But if your jaw hurts because of the jaw joint or muscles around there are not in trouble, obviously that means you're not going to chew very well. So then what happens is you've got a couple of possible compensations that you develop. So if the chewing causes pain, I suppose our natural response may be to 1, select softer food to minimize pain of chewing. 2, you obviously chew less frequently. 3, you change the bite, so top and bottom teeth not grinding as well. Change the bite so you can chew with less pain. And that means you may develop a habit of using your jaw differently. Bite changes, which puts more stress to the jaw joint and obviously the teeth. When we prefer to eat soft foods, we chew less frequently and shorter time. Now this leads to weaker muscles of mastication. They are the muscles of chewing. There are 4 sets of muscles, 4 on each side. They obviously help to chew, grind the food down to swallowable amount. Is there a word swallowable? Anyway, so as a result, if you chew less, your saliva production will subsequently reduce, and that causes dry mouth. Now, so there's a link to saliva production and the chewing. Now here's the role of saliva. Now saliva functions to wash and cleanse inside your mouth, and however, in dry mouth condition, mouth odor may be harder to control as well. Now, saliva also protects one from infections due to viruses and germs. That is, dry mouth increases the risk of a cold or flu or pneumonia, especially in the elderly, especially in a cold season like winter. Saliva keeps your teeth and gums healthy by protecting it from infections. That is, dry mouth can lead to gum disease and infections. Now, dry mouth may be a reflection that the saliva production has reduced. Now, if you notice drier mouth and have pain in the jaw joint on chewing or opening mouth, it is very important to seek help to treat your jaw pain so you can chew properly, so you can then, as a result, produce proper amount of saliva. At the same time, dry mouth can occur if you're a mouth breather. Now, mouth breather in any case could be due to deviated nasal septum. That means the nasal passage in the nose is not straight or often narrowed, or chronic sinus issues such as infection in the sinus. You can also get the sinus type headache related to your upper cervical spine due to postural issues. We can all assess that definitely and treat accordingly. Now, so other thing is, where's your tongue? The tongue decides, the position of the tongue decides how you breathe. So for you to be a nose breather, which is what we would like you to be, your tongue needs to be at the top. As the top teeth, the front teeth come down, your tongue kind of sits right at. If I show you on this model, here your jaw is like that. Tongue needs to be right here, just behind the top teeth coming down. There's this rough surface called the alveolar ridges. Okay, So that's the ideal position of your tongue, with your teeth apart, top and bottom teeth apart, but your lips closed. So that's your resting position. Make sure you feel the weight of your jaw and teeth apart, lips closed, tongue, tip of the tongue on the roof of your mouth. And this enables you to breathe through your nose and therefore have your, well, we talked about that already. So your mouth can remain moist and saliva can protect you from gum diseases, infections. So, and also the tongue can be trained. So they're the things the physios can help. So please seek help if you are finding dry mouth or your jaw pain is there, and obviously having trouble chewing things, which possibly can reduce your saliva production, keeping your mouth dry, which can expose you to higher risk of infections through dry mouth. So I look forward to hearing from some of you, possibly, or please seek help from your local physiotherapist who has special interest in treating jaw problems. And I look forward to hearing from you or seeing you in another episode of Joker's Physiotherapy. Cheers! Oh, by the way, if you like these videos, please give us a thumbs up and please leave us a comment and subscribe if you'd like to see more of these. It really helps me to motivate to pump out all these informations. Hopefully they are very useful. Okay, cheers!